2011 federal election debate on the future of healthcare. I want to thank all of you in the audience for taking the time to come out tonight and to participate in what promises to be an exciting and a thought-provoking evening. My name is Kate Champion. I'm a third-year medical student here at U of T, and I'm going to be moderating the debate this evening. So first off, I'd like to welcome our candidates tonight. We have Dr. Carolyn Bennett from the Liberal Party running in the riding of St. Paul's, Michael Erickson from the New Democratic Party running in the riding of Etobicoke Lakeshore, and Dr. Georgina Wilcock from the Green Party running in the riding of Don Valley West. Unfortunately, our Conservative candidate was unable to come tonight.
No, unable might not be accurate. No. Chose not to.
Chose not to come tonight. And so thank you to the three of you, especially for coming tonight. We really appreciate being able to hear everything that you have to say about your vision for the future of healthcare in Canada. So one of the major reasons that we're hosting the debate tonight here at the Medical Sciences Building at U of T is that the 2014 Health Accord negotiations are only a few years away. And with the new federal government being elected on May 2nd, it's very likely that this Parliament will be responsible for navigating the future of Canadian healthcare through these negotiations. Many members of our audience tonight are medical students and will be on the front lines of the healthcare system that will be shaped by the 2014 Health Accord. So through this debate tonight, we hope not only to get a sense of what the future may hold for our healthcare, but create a dialogue so that we can be part of creating that vision. So to start, I thought I'd quickly review tonight's agenda. Each of our candidates will have the opportunity to make an opening statement on tonight's debate topic. We'll then move on to the formal debate portion of our evening, where the candidates will debate two questions. The first on what they perceive to be the top issue facing Canadian healthcare, and then the second on Canada's physician shortage. Finally, we'll round out the evening with a chance for you, the audience, to pose questions to the candidates, either as individuals or to the group. And so also at this point, I'd like to introduce Alex, who's going to be our friendly sign holder in the front, who's going to let the candidates know when they have 30 seconds left and then when time's up. So without further ado, let's get started with the opening statements going in alphabetical order by last name. Each of the candidates will have 1 minute and 30 seconds. So we can start with Dr. Carolyn Bennett.
Thank you very much, and thanks for doing this. I decided that I should begin with, in that I have lots of opinions, I'll give you the open letter from Michael Ignatieff as the commitment from our leader. This election presents Canadians with a simple question. Who do you trust to speak for Canada as crucial decisions are made about the future of our universal healthcare system? When Liberals talk about equality, health and healthcare is a big part of what we mean. It's the ground under the feet of Canadian families. The Liberal Party's passionate belief in universal, free, quality, timely, public healthcare remains unshakable. We are the party that made universal Canadian Medicare and the Canada Health Act a reality. A stable, high-quality public health system must underpin equal opportunity in Canada in the future, just as it has in the past. That means every Canadian family must be served well and served equally when they need care, no matter where they live. We all know there are challenges in healthcare, and we believe there are two challenges above all: gaps and wide variations in quality and availability of care, depending on where you live, putting more and more pressure on Canadian families, and provinces are struggling to contain rising expenditures, a struggle that will become even more difficult as our population ages. Given these challenges, after 5 years of neglect under Stephen Harper, a Liberal government will get serious and get back to the table for health and healthcare and convene a First Minister's meeting within 60 days of taking office.
Thank you very much, Dr. Bennett. Next, we'll move on to Michael Erickson.
Hi, everyone. I teach high school, so I like to stand a bit when I talk, if that's okay. So before we begin today, I just want to frame for you some things you're going to hear going forward. I have a lot of respect for both people as individuals up here today, so it has nothing to do with them. But let's talk a little bit about who you trust, histories and parties. Because I do think that it's interesting that we just heard a history revision done by Mr. Ignatieff. So we know that healthcare came to Canada because there was a Liberal minority government that was pressured by the NDP party to make healthcare in Canada a reality. We know that, so I'm not going to tell you that again. We also know that during the 90s, when the Liberals had a majority, when they harmonized the transfer payments, they reduced payments to provinces, which created the healthcare crisis that we experienced in Ontario, which then paved the way for the Harris government that we've all experienced. So, and during that time, as the surplus is built, they didn't reinvest in healthcare. And the Conservative government afterwards also didn't invest one iota of funds in healthcare past that which was agreed, I believe, in 2005. So we'll continue tonight, but I think we're going to hear a lot of great ideas and great plans. But it's our party, the New Democratic Party, that has the history of putting our plans into action, and we don't waver when it comes to healthcare that is accessible and fair in this country.
All right, thank you very much. And so now on to Dr. Georgina Wilcox.
Well, as an obstetrician, I usually do my job sitting, so I'm going to stay sitting. I'm a very reluctant politician, and I often ask myself, why am I doing this? But then I think of Semmelweis, a fellow obstetrician, albeit from another century, who argued that hand washing would help to prevent puerperal fever. He was ridiculed. I stand before you because I want a healthier and more sustainable future for ourselves, our children, our city, country, and planet. This will not be easy, especially as the major parties and the media barely mention the most important issues. And yes, at times I hear the ridicule. The issue of the 21st century is the environmental crisis. We face climate chaos, accelerating species extinction, acidification of our oceans, increasing pressure on our food production. Climate crisis and food shortage will have direct effects on our health. The Russian heat wave of 2010 caused 11,000 excess deaths. I see unemployment and lack of hope that disproportionately affects the young. Heart disease, diabetes, cancer, and serious psychopathology all share one factor as their #1 cause, and that is poverty. Currently, 15% of Canadian children live in poverty. I am appealing to you as future physicians to inform yourselves and advocate for environmental regulation. When physicians speak up about smoking or cosmetic pesticide use, people listen. We all need you to speak up again about the climate crisis.
All right, thank you very much. So now we'll move on to the formal debate portion of the evening. So we'll start with our first question. What do you perceive is the most pressing issue facing Canadian healthcare today, and how do you and your party plan to address it? Each candidate will have the opportunity to make a 2-minute opening statement. This will be followed by 10 minutes where the candidates will have the opportunity to respond to the other candidates' statements or to ask other questions of the candidates. So for this portion, you would each have a minute to speak. Does that make sense? Okay, great. So we'll start in reverse order this time. So we'll start with Dr. Wilcox.
So can I